Around a third of people with metastatic melanoma, they may have a brain mets upon presentation. If they don't have brain mets upon presentation, the chance of having it within 1 year is around 20 or 30%, and within 3 years is around 30 to 40%. The cases usually are discussed in a multidisciplinary approach, multidisciplinary conference. We have radiologists, radiation oncology, neurosurgery, neuro-oncology, medical oncology, pathology, and we tailor the treatment based on many factors, based on the age of the patient, the symptoms upon presentation, the number of brain lesions, the size of brain lesions. So, for example, if a person presents with symptomatic metastatic melanoma to the brain, such as stroke-like symptoms, headaches, we look into the MRI images. Is there any major lesion that needs to be removed? And by removing it, hopefully the symptoms would be better. Is there any smaller ones that's causing some functional problem, and hopefully a gamma knife would be an option. And then for me as an oncologist, I would like to know the BRAF mutational status of this melanoma. If it's a BRAF mutation, BRAF V600E or K mutation, then for people with symptoms, I am tempted to give targeted therapy. These people would be on a high-dose steroids, so we know immunotherapy would not be an option here. I give targeted therapy for about 8 weeks, 8 to maybe 12 weeks. We do scans. Hopefully we see some responses. We examine the person, and hopefully the neurological signs and symptoms would have resolved. And then at that point, I would be more tempted to switch the person to immunotherapy. I would not keep the people on target therapy until they progress. The strategy here is, we call it bridging strategy. So basically, once we have some stabilization of the symptoms, improvement in the overall health of the person, we try to switch them to immunotherapy. And the treatment of choice would be ipilimumab and nivolumab. The ipilimumab 3 milligram per kilogram and nivolumab 1 milligram per kilogram, IV infusion every 3 weeks, followed by single agent nivolumab at the dose of 480 milligram once a month, to complete a total of 2 years of treatment.